Hi, my name is Fady and I'm a local member of the Thursday Island community. Today's presentation will give you an insight into Thursday Island as well as exploring specific recruitment and retention issues for medical practitioners working here and strategies used to combat these issues. Thursday Island is a welcoming island community located off the northern coast of Cape York Peninsula. It is 2,640 kilometres northwest of Brisbane, 804 kilometres south of Cairns, 140 kilometres southwest of Papua New Guinea, and 35 kilometres northwest of Cape York. Thursday Island is the main island in the Torres Strait region, and as of the 2011 census, its population was 2,610 and is comprised of 51% females and 49% males, of which 64% identify as Torres Strait Islanders. The median age of the Thursday Island population is 28 years of age, 9 years below the Australian average. 82.6% of people living in Torres Strait Island were born in Australia. The other top responses for country of birth were Papua New Guinea, England, and New Zealand. 47.7% of people speak English as their first language, and 15.9% speak Yam Klatok, Torres Strait Creole. Thursday Island is home to 37 education facilities spread over the Torres Strait region, including state and private schools, preparatory year followed by year 1 to year 12. It also provides special education and consists of the Tropical North Queensland Institute of TAFE and James Cook University and University of Queensland. 63.4% of the people living in Thursday Island are employed full-time and 20.8% are working on a part-time basis. Thursday Island has an unemployment rate of 4.5%. The main occupation of people from Thursday Island are professionals, clerical and administrative workers, community and personal service workers, and labourers. The industries in Thursday Island consist mostly of pearling, fishing, and tourism. The median individual income is $707 per week, and the median household income is $1,712 per week. Other services in Thursday Island include Ibis Supermarket, Chemist News Agency, FPOS Facilities, National Australia Bank, Australia Post with Commonwealth Bank Facilities, Our Lady of the Sacred Heart Catholic Church, All Souls and St Bartholomew's Anglican Church, Police Station, Torres Strait Council Library, direct retail shopping from Cairns using freight services, and pubs. The average temperature on Thursday Island is depicted on the following table. Transport is either by walking, 28%, or driving, 30%, with limited public transport. Thursday Island has various sporting clubs and facilities including tennis, pistol shooting, football, basketball, and rowing. It also has the Torres Shire Council Sporting Complex. Other activities include Thursday Island tours and cruises, the Maritime Museum, a historical cemetery, and the Green Hill Fort. Camping and fishing are also very common activities on Thursday Island. Marble Day on the 3rd of June and the Coming of the Light Festival in July are two very celebrated events in Thursday Island's calendar. Health services in Thursday Island are provided by either the Thursday Island Hospital or the Thursday Island Primary Healthcare Centre. The Thursday Island Hospital is a 38-bed facility providing health services to the residents of Thursday Island as well as the outer islands of the Torres Strait. Services provided by the hospital include emergency, general medicine, and maternity services. Specialist services include diabetology, obstetrics, pediatric medicine, adult mental health, and general surgery. Allied health services available include podiatry, pharmacy, physiotherapy, occupational therapy, and radiography. Thursday Island Primary Healthcare Centre provides primary health services including general practice medicine, child health, oral health, adult maternity health, drug and alcohol rehabilitation, men's and women's health, HIV and AIDS rehabilitation, diabetes and nutrition, health promotion, and healthy aging. Lastly, Thursday Island classified as RA5, which is very remote Australia. ASGC-RA is a geographical classification system that was developed in 2001 by the Australian Bureau of Statistics as a statistical geography structure which allows quantitative comparison between city and country Australia. We will now be switching to Dr. Tadros, a resident dentist in Thursday Island, and Jacob, a prospective dentist considering working in Thursday Island.
Hey Dr. Tadros, so I'm a bit apprehensive about coming and working here on Thursday Island. I'm originally from Sydney, and I feel I'm going to be confronted with some recruitment and retention issues that are going to affect me with regards to my professional and personal experience as a practitioner.
Sure, Jacob. I've spent most of my life here in Thursday Island, and I'm sure I'll be able to give you some helpful hints and strategies that may help you put you at ease. With regards to any of these issues you might raise, certain strategies need to be developed to help recruit, retain, and maintain future dentists by providing certain initiatives and incentives so that rural areas such as Thursday Island are not left in need.
That definitely does make sense. Firstly, there are the professional recruitment and retention issues. Collaborative teamwork on Thursday Island would be difficult, mainly due to the high staff turnover rate and constant movement of staff, making communication hard. This lack of communication can in turn lead to disputes and inefficiency of the resources at hand. Cultural differences and differing opinions can also give rise to confusion with decision making. Also, as a practitioner, I will definitely have an extended role as a dentist compared to my counterparts in metropolitan areas. I have also been told that on Thursday Island, specialists are not constantly available, so liaising with them may be very difficult.
Well, Jacob, professional development and maintaining a healthy work environment is essential when working in a group in a remote area. A clear hierarchy of decision making should be made to acknowledge and utilize the expertise of a team member and minimize conflict and confusions. This also entails an understanding of each other's roles. It is also paramount to seek harmony when conflict occurs by listening carefully and respecting all opinions given. You must remember to be positive, open-minded, and respect others during all interactions. With regards to the distance between professionals, communication can be improved through the use of technology such as satellite phones and video conferencing.
I see how those strategies would help. The second issue relates to the scope of practice. Without having a referral base of specialists, higher stress and burden is placed on the dentist that forces them to work outside their scope of practice. This may be attributed to a lack of resources and health professionals available. This could also apply when there is a dentist not available, where GPs may be pressured to carry out pain-relieving extractions since the dentist is absent.
Well, Jacob, the use of clear guidelines and protocols is essential for specific situations outside the normal scope of practice to help to protect you as a practitioner. It is also paramount to always document the procedure for future reference. A support network of fellow practitioners and specialists can also be made available for video conferencing and online tutorials, allowing dentists or any medical practitioner to more confidently perform procedures outside their normal day-to-day work.
Thanks for that insight, Dr. Tadros. As Thursday Island is such a tight-knit population, I feel a common problem is that everyone knows the local health professional. Problems may arise when members of the community have unrealistic expectations of the healthcare worker, such as calling them at home or visiting them at home. The small population size would also give rise to difficulties maintaining confidentiality, would it not?
Yes, Jacob, you raise a very good point there. This can be solved by keeping contact details on a need-to-know basis and setting down clear boundaries to patients with regards to professional and social life. Confidentiality can be maintained by holding appointments in private locations and keeping accurate clinical records in a safe place.
Reading up on Thursday Island, I discovered there is only one small dental clinic situated in the primary care centre. Specific equipment required to set up a dental clinic that satisfied the ADA rules is hard and very expensive to purchase, deliver and set up in a rural area. Dentists may face the problem of limited facilities and equipment when needing to carry out specific procedures. Although on Thursday Island there is access to specialist services, they are usually on a visiting basis and are not available all year round. What are some strategies to help combat this issue?
Well, Jacob, running costs of dental facilities really is higher, An ADA grant or incentive to set up a practice in a rural remote area may be provided, and this would help immensely. It is also important to have a monthly, well-planned and organised roster of specialist visits, as well as further incentives and initiatives for them to visit Thursday Island. I can show you an example of this roster later when we visit the clinic.
That would be good. Thanks, Dr. Tadros. So, on Thursday Island, there is limited face-to-face communication with other dental professionals. There is also a shortage of other experienced dentists to provide me assistance that may cause stress for me when confronted with unusual or complex cases. What strategies can be undertaken to help alleviate this issue of professional isolation?
Strategies to combat this include developing healthy relationships with colleagues and other health professionals and seeking advice from professional mentors. It is also a good idea to record your experiences in a journal and be prepared to ask for help and information.
Thanks for all those recruitment and retention strategies to help alleviate the issues that I may face professionally. If I may now raise some issues that may affect me personally. Many of the services and facilities available in cities and towns are not accessible here on the island. Therefore, I'm sure it is paramount for practitioners to adapt to the new social and physical environment. I feel many of the challenges I face will be due to variations in my daily living. Firstly, homesickness can definitely give rise due to living away from family and friends. What is a good strategy you have used to overcome this?
To better integrate into the community, volunteering in community events, weekly sport events, and community gatherings and recreational nights will help fight boredom, loneliness and social withdrawal, and will also help make contacts and allow you to better integrate into the community. And of course, laptops and internet can be used to keep in constant contact with family and friends. It's also a very good idea to plan trips to nearby cities for breaks.
They sound like good ideas. And Thursday Island is very humid and can reach quite high temperatures. Being from Sydney, how can I not find this change in weather so confronting?
Well, Jacob, this ultimately depends on the flexibility and ability for you to adapt to your new surroundings and embrace it.
Yeah, I guess you're right. Thursday Island also has very limited public transport, especially in comparison to large cities like Sydney, where I'm from. Also, attending the required number of CPD lectures is much more difficult and expensive due to the distance and effort needed to travel to reach the large metropolitan cities where they are held. What are some solutions to these issues?
With regards to transport, like I mentioned before, the most important thing is for you to adopt an easygoing and flexible attitude. Travel grants either by the ADA or the government or even the clinical care in Thursday Island can help pay a certain percentage of the costs to sit the exam. We can discuss those specifics later if you wish.
Yeah. That would be great. People of Thursday Island have distinctive beliefs and customs, and communicating effectively with members of this community, especially Indigenous patients, requires varied strategies that a dentist such as me from a metropolitan area may not be accustomed to. Language barriers may lead to a poor patient and dentist communication. I also might not be culturally sensitive and aware that the Indigenous population is the majority, and hence I might interact in a non-culturally aware and safe manner.
It is very good that you have raised these points, Jacob. In order to be more culturally sensitive, attending informative workshops and training programs prior to settling into any new remote town is crucial. An introduction and education on local conventions and protocols is a good way to provide this. Communication strategies can involve eye contact. Do not have strong eye contact as it acts as a sign of dominance. Physical contact. Handshaking may be a sign of intimidation. As is about standing up, don't stand too close or look over the top. It is important to discuss with patients what will make them comfortable during the treatment and who they need present at the time for them to feel more at ease. It is also paramount to get to know the people and make an effort to get to know the community. Social immersion and involvement in community events will help bridge this gap. Working with a local healthcare worker or mentor will also allow you to work more effectively. Also, being culturally aware and appropriate will prevent any unintentional breaches of cultural norms and reduce tension.
Thank you Dr. Tadros and Jacob for discussing retention and recruitment issues and strategies for healthcare professionals in Thursday Island. Some issues that have been discussed include working within an interdisciplinary environment, scope of practice, lack of anonymity and maintaining confidentiality, limited resources and equipment, professional isolation, social isolation, climate, transportation, communication and cultural differences. We trust today's presentation has successfully provided an insight into working as a healthcare professional in Thursday Island through all the strategies that have been previously discussed. Thank you for your attention.